a form of cancer? Hello and welcome to the channel. In this video, I shall discuss the cancer diagnosis of King Charles III from a purely medical point of view. This week, it was announced by Buckingham Palace that the King has a form of cancer, this having been detected in the course of a procedure for benign prostate enlargement. The official statement reads thus: during the King's recent hospital procedure for benign prostate enlargement, a separate issue of concern was noted. Subsequent diagnostic tests have identified a form of cancer. His Majesty has today commenced a schedule of regular treatments, during which time he has been advised by doctors to postpone public-facing duties. Throughout this period, His Majesty will continue to undertake state business and official paperwork as usual. The King is grateful to his medical team for their swift intervention, which was made possible thanks to his recent hospital procedure. He remains wholly positive about his treatment and looks forward to returning to full public duty as soon as possible. His Majesty has chosen to share his diagnosis to prevent speculation and in the hope it may assist public understanding for all those around the world who are affected by cancer. What intrigues me is the choice of wording when the announcement was made of this cancer diagnosis. Now, I can imagine that the choice of wording is very important in any Buckingham Palace announcement, especially when it comes to health. Health is, of course, a private issue until it becomes a public issue for those who are in the public eye, like celebrities, like the royals. The King could have chosen to keep his diagnosis completely private. This is, of course, a legitimate choice. If I recall correctly, no one knew of the late Queen's diagnosis of bone cancer until after her passing. There are, of course, many reasons why one might wish to keep a health issue private. One of those is, of course, that one has that right, period. It may also be that one may not wish to draw attention to oneself or cause a fuss, as I can imagine the late Queen would have had this in mind as her diagnosis was concealed from the public. Another reason, and this is quite important for the royals, simply may be the wish not to alarm the nation. The word cancer has, of course, very negative connotations attached to it, even in an age where medical advancement is at an all-time high, and many cancers have better and better prognoses compared to 10, 20 years ago. We subconsciously or even consciously immediately think of chemotherapy, hair falling out, vomiting, even death when we think of cancer. Let's face it, we think of cancer as a death sentence, especially in a 75-year-old monarch who has just acceded the throne like yesterday. So one can imagine that, yes, there may be a real need here to calm the nation down, especially amidst the other dramas that surround the royal family at present. I'm naming no names. But the King chose to divulge that he has cancer. I personally think that this is a good thing because here is an opportunity to open up this conversation, to shine a light on an illness that touches so many of us, our relatives, friends, colleagues of all ages. I already appreciated the fact that the light was shone on the benign prostatic hypertrophy issue because it was an occasion where a specifically male cancer was highlighted and brought to our consciousness, which, although nowadays is increasingly the case, I'm sure the men amongst us would feel that their health issues are also now finally being considered important enough to be brought into the public's consciousness. This wasn't always the case. We are more used to this being the case for female cancers like breast and cervical cancer as a rule. Just to acknowledge actually that, of course, although it's rare, breast cancer actually also can affect men. Just so that no one comes back at me for saying, hey, breast cancer is not only a woman's issue. It's true, it can affect men. So anyway, to my big 3 questions surrounding the statement from Buckingham Palace. What could the cancer be? And why, if an announcement is going to be made at all of cancer, that the type of cancer is not revealed? Moreover, my 3rd question, why use the phrase a form of cancer? Why not just say the king has cancer? I think to understand this specific choice of wording further in the context of investigation and treatment of an enlarged prostate, I would like to take you on a little journey. It's a journey that takes us on the road with a patient undergoing a prostatic procedure. I promise not to be too graphic. Now, when a man complains of typical prostate-related problems like having to wait a long time until his urine starts flowing, like getting up multiple times in the night to urinate, like feeling a heaviness down under, like getting only drops of urine coming out during urination, his doctor, and this can be his general practitioner or his urologist, or as some people like to say, andrologist, would typically have a feel of the prostate by inserting a finger in the rectum and feeling around the front wall of the rectum, because this is anatomically where the prostate basically lives, just in front of the rectum and under the bladder. Of course, this is not very pleasant for the patient, but the doctor gets very important information as to whether it is truly just a benign enlargement or if it is a cancer. It's the consistency. This is very, very important, and this is why the doctor needs to feel the prostate. A blood test is also usually done in the context of a more general blood test, of course, but what I'm specifically getting at here is a specific prostate blood test is done, and which helps in the diagnosis. This is the so-called prostatic specific antigen, or PSA test. And it's just a screening test in much the same way as a mammogram is a screening test for a woman. If everything looks benign, a decision may be made to put the gentleman on tablets to control the growth of the prostate. Sometimes this works very well, and many men require no further treatment. But sometimes the tablets are not enough. In this case, a decision may be made to shave off some of the prostate tissue which is constricting the urethra, the tube going from the bladder to the outside world through the penis. This procedure is called a TURP, a transurethral resection of prostate. For this procedure, a tube is inserted into the penis as far up as the bladder, and then a shaver is deployed when this tube is pulled back a little bit down into the level of the prostate, and peelings of prostate tissue are shaved off from the inside of the urethra. These are just washed off with basically saline water, salty water, as they are flushed out of the urinary system during the following days after the procedure. And in this post-procedure time, a bladder tube is left in, and this can be washed out quite often also with with the help of the nurses looking after the patient regularly, they can wash out the bladder tube so that the shavings of the prostate are washed off, or if there is also some blood, all of this can be washed out. Alarmingly, there can be quite a lot of blood passed, but this is normal, completely normal, nothing to worry about, usually. Occasionally, it's because something is actively bleeding, but, that's very rare. So, back to my 2 questions, or 3 questions. What could the cancer be? Well, there's already a lot of speculation out there in the press, in the media, on social media, about the possibility of this cancer being bladder cancer. Why? Because you have a tube with a camera at the end of it sitting in the bladder. I forgot to mention upstream, of course, the tube that goes in has a camera, so the doctor can see what's going on at the end of the tube so that they're not completely blind, when they're shaving off the prostate tissue that is obstructing the urethra or the urine channel. So you have a tube in the bladder with a camera. If there is a tumor there, you will spot it immediately. But then what intrigues me is, why then don't they just say that bladder cancer? The bladder is not particularly embarrassing as a body part to talk about. In fact, I would think it's arguably less embarrassing than the prostate. The prognosis is not particularly scary in relation to prostate cancer. And most importantly, bladder cancer is just that. It's bladder cancer. One would not describe it as a form of cancer. So I think it would really surprise me if it turns out to be bladder cancer. Could it be penile cancer? Well, penile cancer is kind of a really external cancer. You need to go through the whole process of treating prostate enlargement to spot a penile cancer. If it's a cancer of the penis, it would simply be a blob of tissue on the penis. So, and again, you wouldn't typically describe it as a form of cancer either. It's just a cancer, like prostate cancer, bladder cancer, etc. So again, I think this might not be so likely. Could it be testicular cancer? Again, unlikely. The reason is King Charles is 75 years old. Usually, testicular cancer is a young man's disease. Think Lance Armstrong in his Tour de France heyday. By the way, testicular cancer has a very good prognosis. Could it be that they found something odd in his rectum as they put the finger up, the rectum, to do the rectal examination of the prostate? Yeah, could be. But then again, you wouldn't need to go as far as a prostate procedure in order to investigate something funny in the rectum. So maybe also unlikely. My take on this is that this is something that came up in his blood work. Maybe his liver tests were off, prompting an investigation of that. Maybe they found an anemia, a low red blood cell count, or maybe the kidney function was down. A diagnosis which encompasses all of the above scenarios and which could be present in an individual, especially an older man like King Charles, is the illness MGUS or MGUS. And this is just a short form of monoclonal gammopathy of undetermined significance. So MGUS for short. Monoclonal gammopathy of undetermined significance. MGUS is one of those diseases that can certainly be described as a form of cancer, because indeed it is not a cancer, but it can be a forerunner of certain blood cancers like multiple myeloma, lymphoma, or light chain amyloidosis. It is basically a disease of abnormal protein in blood and of the blood cells, especially the white blood cells. It's basically also a kind of forerunner of a cancer of the blood, of the blood portion which deals with immunity. It is largely asymptomatic, but some patients can present with certain symptoms like nerve symptoms, numbness, tingling in the arms or legs, or even a skin problem, a rash. It mostly does not require treatment, but in a small minority it does when it starts to cause more generalized symptoms like tiredness due to maybe involvement of the kidney or liver, or if it starts to convert into one of the cancers I mentioned above, so multiple myeloma or a lymphoma or light chain amyloidosis. So during this conversion or signs of the conversion to one of the cancers, it's prudent to basically start chemotherapy, start treatment, as though you are actually now treating the cancer itself. So this is where the MGUS progresses to a cancer. So yeah, typically it can be described as a form of cancer because it starts off not quite being a cancer, but then it does finish it off as being a cancer. So yeah, it's a kind of an in-between diagnosis. Now, given his maternal family history, King Charles could also have some other type of bone cancer, like the late Queen. Important is that, of course, MGUS, multiple myeloma, these are bone marrow type cancers, not just blood. So there could be a link there. These cancers of the bone, known as osteosarcomas, can sometimes involve muscle as well, in which case they're kind of, like a mixture known as leiomyosarcomas or liosarcomas or myosarcomas. There are a whole group of cancers which are mostly external, but they can also present in a clandestine way. So they actively have to be looked for. And again, I wouldn't have thought that you would find those out by investigating a prostate problem. But these things certainly can present in a coincidental kind of way. So, I can quite imagine, he's in there for a prostate procedure and says, by the way, I have this. Can you look into that? Or something, So this often happens in real life medicine. Often what the patient presents to the doctor with is not the only diagnosis that they come out with in the end. And this may have happened like this in the case of King Charles. Whatever the cancer is that King Charles is suffering from, I'm sure you will all join me in wishing him a speedy recovery, good health, all the best for his future in health and in life in general. We also naturally wish his family, his colleagues, his friends a lot of support and strength in helping him to recover well and in a rapid fashion. Until next time, stay healthy.